السلام عليكم ورحمة الله وبركاته. الحقيقة I want to start this live and I want to use it for professional only. هذا اللايف أكثر شيء يخص المهنيين والناس اللي عادة يعالجون أطفال التوحد. لذلك سأتكلم باللغة الإنجليزية، والحقيقة طلب مني من بعض المهنيين وبعض الإخوة اللي داخلين في التوحد طلب مني أنه أتكلم عن مواضيع يعني باللغة الإنجليزية لتكون سهلة، حتى الأخوة اللي جالسين في الخارج ممكن يستفيدون من هذه المعلومات. الموضوع اللي اليوم نريد نتكلمه، الموضوع السبجكت هو بالإنجليزية احنا نسميه common pitfalls in the management of ASD. لذلك أنا أطلب من أخوتي اللي عندهم لغة إنجليزية ممكن يتابعون، لكن اللي لغتهم ضعيفة أكيد راح يكون صعب عليهم المتابعة، بس أنا بصورة عامة أريد أستهدف فئة حتى اللي جالسين في الخارج من هذه المعلومات النافعة لهم. So the common pitfalls in the management of ASD. In this live, I want to evaluate the general issue of management of ASD, and then to figure out the most important mistakes sometimes happen or pitfalls happen in the following and management of ASD. The first advice: so many patients when they consult the doctors, when they consult the doctors, they don't advise them to go to a training. So the parents they don't know that the training is very essential for the children complaining of autism. This is a very big problem actually, because so many parents, they depend on the advice of the doctors. So the parents usually when consult the doctors they don't advise them that the training for your child is very essential and maybe it is more important than medication. So in this point, I want to raise the point of training, to put it at the first and the most important step that we can help our children complaining of autism. So this is the most important point. The second important point, that usually the parents, when they consult a doctor, the doctor usually start to give them some medication, and the most important medication used all over the world is the supplement, because most of the children they are complaining of ASD, they have some deficiency of some of the essential supplement. That's why giving supplement to the autistic child from the beginning whenever he is diagnosed, and this supplement might be covering the deficiency of some of these very well-known vitamins or supplement. So in this case, if you want to support the child from the beginning, especially whenever the child has a history of intrauterine problem like birth trauma or something happening during the pregnancy, so it is very important to give the supplement whenever you diagnose a child with ASD, whatever he is complaining of, primary or secondary autism, or classical or secondary autism. So the supplement is very well known now. It's actually a mixture of many of the mitochondrial enhancers. So in this way, I always advise most of the people they are following an ASD child to ask their doctors to give them the essential supplement and vitamin whenever the diagnosis is confirmed of the ASD. The third important point or pitfalls happens in the diagnosis of the ASD is that there is no EEG done for the children with ASD. The EEG is very essential for the evaluation of autism And it is important to guide the doctor not only to rule out the epilepsy or abnormal EEG happens, but also it's also important to evaluate the severity of autism. Whenever we correlate between the EEG and the severity of the excitation happens in the EEG, I mean the voltage when it is very high, and whenever the score of the autism is very low, it is very important for the doctor to know that this is most likely a classical autism and should be treated in a different way than the secondary autism. So EEG is very important to follow and confirm the diagnosis and to use some of medication. Some of the doctors till now they don't believe in the EEG, to use the EEG as a biomarker to diagnose the autism, or even to evaluate the severity of the autism, or even a guide to use some of the medication in case of some irritability in the child or something. For example, whenever you have an epileptiform waves and the child is not responding well to training and he's delaying in the speech, so we can think about this issue by some medication to decrease the electricity in case of a child presented with EEG changes. The third important point in the management of ASD, and usually it's come with pitfalls in it, a treatment of ADHD when it is accompanied the ASD as ADHD when it is alone. So ADHD, which is usually as a comorbidity when it's happening with the autism, should be treated in a different way when it is coming alone, when it's coming alone. So in this way, I want to advise my colleague that we should first of all diagnose the ADHD in a criteria which fit in the what is called a pure ADHD. But whenever it's coming as a comorbidity with the ASD, so the medication will be different, and all the management steps will be different. So just if you want to know how you can manage the ADHD, which is comorbid, the ASD, you have to know what is the pathophysiology behind this issue. In case of ASD, the hyperactivity and distractibility and the inattentivity associated with hyperactivity is usually not due to the difficulty of inhibition, as it is the main pathology in case of pure ADHD. The issue is usually here because of difficulty of management of the proprioception impulse in the body of the child. So this is a sensory problem, and it should be managed by increasing the impulses of sensory problem by giving more activity for the child and give him the more chances to swing or jump or do overactivity in his body, any form of overactivity. So with the time, the brain will be changed to modulate and to calibrate the way of perception in a normal way. On the other hand, the ADHD, when it is becoming pure ADHD, the issue of pure ADHD, whenever it's coming along without any ASD, the treatment is totally different. Medication is very essential in case of primary or pure ADHD. You know there is two type, stimulant and non-stimulant. Both of them, they are very effective, and usually doctor will start with the stimulant. The stimulant is very effective in the treatment of pure ADHD, while if it is used in case of ADHD comorbid autism, it will increase the hyperactivity and irritability of the children. So in this way, we have to make sure that whether we are treating now a pure ADHD or ADHD mixed with autism. So please, we all advise in case of the doctor's they are more interesting of ADHD, not to jump directly to the stimulant in case of ADHD mixed with autism, while you can go directly to the stimulant in case of ADHD without autism. The fourth issue, or the fourth pitfalls happens in the management of the ASD is evaluation of the IQ in case of children with ASD. So many doctors, when they want to evaluate the IQ of the children with the ASD, they use the same measure they are using in case of evaluation of a normal child. And this is actually a big pitfalls, because if you want to evaluate the IQ of the child with ASD, it is very hard to communicate with him and to give him a real value for his IQ or score. In this case, we advise to use an adaptive skills like Finland to do the evaluation of the IQ for the children. IQ, whenever it is evaluated using the normal way, it is very hard to evaluate the real intelligence of the child, because the child is not well understand the communication, especially whenever the receptive language is affected also. So I advise to use the Finland Adaptive Skills Rating Scale. It is very important, and it is very useful to know the average IQ for the children when I am treating a child with ASD, rather than using a normal intelligence coefficient. So this is also a common pitfalls happens in the management of ASD from professionals. The other thing is the using of atypical antipsychotic. The most common pitfalls in using atypical antipsychotics in the children is that using atypical antipsychotic with children without irritability or without hyperactivity or aggressiveness or self-injurious disorders, it will be not logical at all, because it will increase the sedation of the child and decrease the interactive possibility of the child. And this way, if we are calming the child who is already calm by more atypical antipsychotic like risperidone or Abilify or more, in this way actually we decrease the chances of learning opportunity for the child. So I don't advise, from my point of view, to use this medication in case of a calm child, cooperative child, well interactive child. Only in case of irritable child or hyperactive child or a difficult child or aggressive child or self-injurious child. So many doctors, they are prescribing this atypical medication for most of the child. They consult them as a way to improve the core symptoms of autism. And actually, as we know all, that the core symptoms of autism, it's very hard to be treated by medication. But if we want to decrease the irritability or aggressiveness of the child, it will be more logical to use this medication. Otherwise, we will get a more side effect without benefit. So this is another point also in the management of the children. The last point, I think it's very important. I think this is useful for most of the doctors, even also people that are living outside of Iraq, that sometimes they ask me to give them some advice in other language or to put some translation in below. But I want to tell you that the training still is very essential in the management and the treating of autism. Treatment of autism is very successful if we combine medication plus training. The training is very useful in all means of training, but we always consider that mixing the ABA-based programs with the Sunrise programs, it will be very useful. So we try to use the advantage of many things, because this is a very challenging problem, ASD. So using the advantage of the programs, the medications, all together, and the family support, it might work all together in a more successful way. So I am always advise most of the people to consult a professional doctor and to use the medication in a proper way, in adjacent to the using the training in the home and the training in the centers. So please, use all these things to improve the child. Otherwise, it's very difficult to get the child out of the autism. You might improve your child, but there is limitation. So if you don't use all the power in the medication and in the training altogether, it will be very hard to get the child out of autism totally. So the success rate of the ASD treatment in this way, combination of medication and the training and different program and different part like the family and the centers, whenever all together work together, we can have a very good % of successfulness. And I guess that 50% of most of the ASD, they are improving till the maximum benefit and to be semi-normal. And there is another 50% they are moving forward in about 10 to 50% from their skill or from their ability to be independent or communicate using different form of communication. This is the first trial for me to introduce some lectures or points in English. I want to increase these numbers to help also some people that are living outside the Iraq, and also to put this information in a more scientific language and to communicate with more and broader people and to share with them my experience. And we are welcome to any experience can be shared with us. Thank you very much and see you again. Bye-bye.